So I recently wrote a blog about the relationship between eyelid surgery and brow surgery. And it's a really important topic. It's one of my favorite things to talk about, and it's one of my pet peeves. Because for forever in the world of aesthetic facial surgery, we've talked about eyelid surgery and we've talked about brow surgery. And the truth is, it's one thing. They are one indivisible area of the face. We can't talk about one without the other. And I just wanted to talk a little bit about that, explain a little bit about that. So what's the story? Most people come in and they say, Dr. Shenker, my eyelids feel heavy. I want you to do an eyelid surgery. And if they've done lots of research, they'll say, I want you to do a blepharoplasty, which is the fancy name for an upper eyelid surgery. And I examine them and I look at them and I say, yeah, you know what? You actually do have a little bit of excess skin on the upper eyelid, and we can take that off and that'll be great. And then I move into the next part of the conversation, which always gets people grumpy with me. And I explain that, listen, part of the problem is the skin on the upper eyelid, but part of the problem is the skin of the brow and the temple has all come down and it's acting very heavy on the orbit or the bone of the eye socket and on the skin of the upper eyelid, and I cannot fix one without fixing the other. They are inextricably linked. We should stop talking about them like they're two separate operations. We should stop talking about them like they're two separate parts of the body. It's one aesthetic unit. We have to manage it together. And it's not that big a deal. You know, there was a time many years ago when it was called a brow lift, and patients were terrified of it because they thought their brows were going to end up here and they were going to look surprised all the time. That's just not how we do it anymore. And so I don't even like to use the word brow lift. We call it a temporal brow adjustment or a brow adjustment. And it's subtle and it's soft and it's easy. And you can't get a nice result in the eyelid without doing something to the brow. That is true in 90% of cases. Very rarely I will see a patient whose brow is in beautiful position and they have just maybe 5 or 6 millimeters of skin on the upper eyelid, and I'll take that off and that'll be it. But that is not the case in most people. And so if you're going to see me or someone like me for consideration of some work around your orbits, your eyes, to try and get your eyes look a little more open, a little more awake, do not be surprised if I talk to you about doing something to the outer 2/3 of your brow to make your eyes look more awake, more open, and take some of that weight off the upper eyelid. If I don't do the one, I can't do the other. And so that's the story. If you have questions, I'm more than happy to chat about it. Come on in and see me. Read the blog I wrote about it. It's a little more detailed than this. And that's it. I hope that helps. Hope that answers some questions.